maybe less than 90, about 80-degree angle in here. And her nasofrontal angle also is a little bit reduced. So I'm going to work on two things. One, lifting her nasal bridge. Number two, softening the amount of curvature of the hump. And number three, bringing up the polybeak. We can see where her cartilage starts to dive down here, and it's elongation of the columella. These are all problems that are best fixed surgically. So sometimes we'll just talk about, don't you want to do surgery?
Oh, yeah.
She does, but she's
Ideally,
nervous. She's nervous, and we're doing baby steps. And so I think that's always so important to disclose to your patient, that it's going to be a challenge and that the gold standard is surgical. So we're going to try to bring her tip up to about 120 degrees. I think that would look really good on her. We're using a very basic middle school protractor. And look at how her nose projects from her facial plane. We want to see about 30 degrees of projection off the vertical plane of the face. In her case, it's almost about 60 degrees, so her nose really needs surgical trimming. In this case, to do filler on her, I'm going to imagine with my mind's eye how deep I want the nasofrontal angle to be and how much filler is going to actually have to be placed. That little gap area is all going to need to be filler, because we're going to bridge the junction from the radix all the way down to the nasal bone here. And then we're going to have to lift the tip this much. So I really like to use these kind of measuring tools, because in your mind's eye you have to decide what you're going to do with the tip of the nose and the bridge of the nose. So let's begin. You can see the septum that protrudes right there in the midline. In order to hide that hooking and downward tilt, we are going to build up the nasal tip cartilages. So I'm going to make two nice tip defining points right in there. And then we're going to add some support here in her columella as well. When we're injecting, we divide the nose into thirds. The upper third of the nose is the danger zone where the dorsal nasal artery can come in from the sides. We've got to be so careful here, because that's where communication can occur up to the supratrochlear and supraorbital arteries. In the middle third of the nose, technically that's your safest area. So, but even in the middle third, the angular artery crosses in here. Okay, I'm going to draw where we're going to keep her nasal tip enhanced here. Here, her lateral cartilages are slightly bulbous. And if we draw this out, this will give us a good idea of where to place our filler. So those are the lower lateral cartilages. Here we have the medial crural foot plates. And so I want everyone who's doing liquid rhinos to be able to draw in their mind's eye these lower lateral cartilages, the medial crural foot plates here. Think about the radix, which is the highest point where the forehead bone hits the bridge of the nose here. The rhinion, where the nasal bone touches the cartilage. Transition point from dorsal bony anatomy into cartilaginous anatomy, that's the rhinion. And this soft tissue junction very often has blood flow. So these are areas where we're going to be very cautious. As we're looking at the nose, I'm looking for asymmetry. And she's asymmetric. So she has a hump, but she also has an asymmetric hump. And perhaps you can detect that this hump is fuller than this side. So that's something that we'll need to camouflage. When I look at her dorsal aesthetic line, which is the line from the eyebrow all the way down, we can see that she's going to need some volume in here. That's where we're going to fill the hump. And creating a beautiful dorsal aesthetic line is going to give us the illusion of a straight nose, because light is going to hit her well in photographs. So two areas I'll focus on here, up at the bony dorsum and in here on the lateral nasal wall, to create an area where we can hide her hump. Our first bolus shot here is going to be directly on the radix and staying in the exact midline and directly on bone, on periosteum, aspirating. I'm stabilizing, I'm aspirating, and then we're injecting a small bolus of 0.05. No more than 0.1 cc should go in our bolus. My injection is perpendicular and coming in so that I'm perpendicularly placed with my needle against the bone. I aspirate and then inject. And as I inject, I'm making a vertical column of filler. I'm not doing a bolus that's deep and wide and a lump in there. I'm creating a pillar. So that's actually a really nice tip, because we want height in the middle to bring the hump up. And so we're going in. We can do a one-handed aspiration if we're very stable with our hand and we have a good bony purchase. And then inject. As I'm injecting retrograde as I pull out a vertical column of filler. So you don't always see that on fast time-lapse videos, what people are actually doing. So this is one of the tips, is to create height with your filler and not just a round kind of dollop of filler. And now I'm going to work on creating her dorsal aesthetic line. And she has a sharp bony spur. So in order to hide the bone spur, we're going to have to create a buttress, a little lateral nasal bone wall. So we're creating the illusion that she has nasal bone here on the side wall of the nose. This is also a danger point, so aspirating is critical. And 1, 2, 3, little pinch, a little aspirate, and these are even smaller boluses because I don't want to create width here, and I actually don't want to draw attention to anything. We only want to give the illusion of light hitting here. So this is the danger zone because dorsal nasal artery comes into this area. And oftentimes patients have an open roof deformity. This technique is also good when they have an open roof where you see two prominent sharp spurs of bone sticking up and you don't see a rounding. I will often create a little bolus of filler in the middle to round that out. Let's do the same thing on the opposite side. And then small, tiny boluses, 1, 2, and 3. And I'm pinching here with my other 2 fingers because I'd like to occlude, if, for example, dorsal nasal artery is coming into here, I'm going to pinch it and occlude it and prevent any retrograde flow of filler through that artery and stop any pulsations there. Always palpating the nose is so important. You'd be surprised how often you'll actually feel a pulse there because your patient is nervous, their blood pressure is high, and that will just, freak you out as the injector. In a good way, because it'll make you get on your toes and realize that there's a danger zone in there and be real careful. Okay, already we can start to see some nice changes. Look at that pretty dorsum, it's looking good. And then let's bring the tip up. And we're going to bring the tip of the nose up and create 2 tip defining points on those lower lateral cartilages like we talked about. Because she has a rounder, more bulbous nose, I'm going to first work on the apex of the tip. So I'm pinching the nose up. I'm imagining where I'd like her tip to go because it's all about training your eye to be artistic. And then I'll probably go around and do that on the other side as well. I get as deep as I can, so I'd like the bolus to sit on the top of the 2 cartilages. Okay, so that actually has changed the tip trajectory pretty nicely. And she has a super tip break point here, and she has nice tip defining point directly in the midline, which I'm going to accentuate slightly more. And then we're also going to create the 2 tip defining cartilages on the side of that, but subtly because I don't want her nose to look bigger, but I do want to hide that cartilage, the polybeak. So I'm just rounding out the remainder of her lower lateral cartilages to hide the polybeak as well as create that tip defining point. So I'm coming in from above and making the apex of the lower lateral cartilages look prettier. So now she has a fuller, more rounded lower lateral cartilage, a pointed apex, a small super tip break point. We've hidden the dorsal cartilage pretty nicely, this hump, the polybeak, fairly nicely. We're going to add Botox and add some columella lift. And let's also place a droplet of filler here where the rhino is, the junction of the bone and the cartilage, and she has a little irregularity there. So it's important to take a step back, always look at the patient from the foot of the bed. Okay, here we're adding to the dorsal nasal angle. And as you get a little more experience, or once you've done a cadaver course and you understand the feel of the anatomy here, you can feel with your needle, and that's where we're sometimes going to not aspirate. It sounds like we aspirate every single time, but I would say I aspirate mostly 50% of the time, but not 100. When I'm on bone, I may not be aspirating. I don't want her nose to look too wide, but I also don't want it to look pinched in any area. So these injections are very superficial, they're just kind of in the skin. And there is a little risk there, so that's why I'm very tentative and doing just very small amounts. Let's do one more bolus on her tip. Alright, now we're going to place a little Botox at the base of the nose. When she smiles, her tip comes down. I am using a very small amount, just 2 units. I don't want it to migrate towards the labial muscles and affect the smile, but it does make the tip come up a little bit. And I also like to treat bunny lines. Go ahead and wiggle your nose like a bunny, because repeated bunching in this area is going to slightly affect your filler. And then I'll take another 2 units for this bunny line. Let's take a look at our results. So this is a really beautiful result. You can see we've camouflaged the dorsal hump, the bony hump, the cartilaginous hump, the septal protrusion, which was giving her a downward hook of the nose. And then we've also improved the tip defining points of the nose, giving her a nice nasolabial angle, which now measures about 120 degrees. So that looks really beautiful. It rivals surgical. How do you like it?
I love it. I look different.
You look different, yeah.
It's so different.
Is it beautiful?
Yes, it's perfect.
You feel really pretty, I bet. I love how it's feminine, and you look like you. You
Yeah.
look like a different person, but boy, it takes the focus off the nose and makes me look at your eyes now.
Yeah.
It looks really good.
I think.